Thank you very much, everyone. We're going to be starting the session in about 2 minutes. All right, good afternoon, everyone. Appreciate your patience with some of the programmatic delays. Thank you very much for joining us for Thematic Session 2B, Natural and Built Food Environments. And without further ado, it's my pleasure to invite and welcome our session chairs for this session. First, Dr. Malaya Kanti-Mrida is a professor of the Brack James P. Grant School of Public Health of Brack University, Dhaka, Bangladesh. He is a medical doctor and completed his doctoral studies in nutrition from the University of California, Davis. He is an internationally recognized scientist and leader in public health, non-communicable diseases, nutrition, and maternal and child health research. As the founding director of the Research Center of Excellence for Non-Communicable Diseases and Nutrition of Brack University, he is currently implementing a comprehensive research agenda to control and prevent NCDs and malnutrition in Bangladesh and the Global South. Kenda Cunningham is currently a senior research advisor with Helen Keller International, supporting implementation and research projects across Asia. Kenda is the principal investigator of an Amana grant focused on models testing program impact paths and their moderation by different inequities, and the co-PI for the Namaste MMS trial and 3 related studies in Nepal. She holds a DRPH from and is an honorary assistant professor at the London School of Hygiene and Tropical Medicine, Faculty of Epidemiology. She is also associate editor of Maternal and Child Nutrition and sits on various advisory boards and technical working groups. Please give them a round of applause. Over to you both.
Thanks, Julie. So welcome to this important session on natural and built food environments. As you know that we are living in South Asia, and South Asian land mass for these 8 countries, it's only 4% of this world, but 25% of world's population live here. So there is a huge strain on both natural and built environment in terms of ensuring food for everyone. And today we have 9 presenters for this session, 5 longer versions of presentation and 4 shorter presentations. And each presenter, for the longer version will get 8 minutes. After 6 minutes, you will get a reminder from Roti, our timekeeper. And so without further ado, let us start this session. And I'm going to invite, and pardon me if I mispronounce your name, Muhandira Lage Madhusha Sanjeevani Karunanayaka, and she's going to talk about adolescents' food choices and what influences adolescents' food choices and their behaviors. Over to you, Madhusha.
Imagine you are standing in a school canteen during lunchtime. Then students are moving around, taking their snacks and meals. Have you ever thought what influenced their food choices? Is this the taste, appearance, or something else? Today, I am excited to share the insight of our research on drivers of adolescent food choices and how the school food environment plays an important role in shaping their decisions. Let's take a closer look at the background of this research. We know that students' food choices are quite complex. Unhealthy dietary habits during adolescence may lead to triple burden of malnutrition and increase the prevalence of non-communicable diseases later in life. In this context, school food environment plays a critical role in shaping their decisions. To better understand the school food environment, we can visualize it through different dimensions. It includes individual factors, social, physical food environment, and macro level environment factors. So the objective of this research is to identify the key drivers of students' food choices to get a comprehensive understanding about how the school food environment influences on food choices of school children. By understanding these drivers, we can design our research intervention, ultimately helping to promote positive dietary habits among school children. Next, let me explain the method of this research. We used a mixed method approach to collect data across 18 schools in Sri Lanka, located in Gampaha and Kurunegala districts. We used 3 data collection methods: in-depth interviews with school principals, in-depth interviews with school principals, focus group discussions with secondary school students, and surveys with students to capture their perceptions on the different dimensions of the school food environment in related to their food choices. When it comes to the data analysis, we qualitative data analyze using the NVivo software to generate key themes, and quantitative data analyze using the descriptive statistics. Before diving into the result, I want to highlight few components that we observed in the school food environment. The first one is school canteens. In Sri Lanka, school canteens lack the basic facilities, even the seating arrangement for the children to sit and enjoy their food. Second, nearby food outlets. All the food items restricted inside the schools are available in these places. Third, peer influence. Most of the children tend to eat food with their peers and share the food with the peers. Finally, school gardens. School gardens showed a potential to promote positive dietary habits among school children. However, in Sri Lanka, schools need a better support and planning to make it successful. Now I am moving to the results of the in-depth interviews with principals. We identified 4 key themes through the discussions. Theme 1, individual factors. According to the principals, students have a strong preference for the energy-dense food over the nutritious food because of their taste, appearance, and the convenience. Nutritious food are less appealing to them. In addition to that, student food choices are limited to cheap junk food which are readily available and affordable to students. Theme 2, social factors. According to the principals, most of the principals highlighted that student food choices are determined by their peers. In addition to that, due to the busy lifestyle of the parents, students usually bring unhealthy foods to the school canteen. Theme 3, physical food environment factors. According to the principal, most of the principals observed that students exposed to a wide range of unhealthy foods from the school canteen and food outlets located near to schools, including mobile vendors. Theme 4, macro level environment factors. So most of the principals noted that students are attracted to certain unhealthy food by the food advertisement through the mass media and social media. Now I am moving to the findings of the focus group discussions with secondary school students. We identified mainly 3 themes. First one, personal preference. Adolescent food choices are largely based on the personal preference because of the taste and the convenience. Second, peers. Adolescents are highly influenced by their peers when it comes to the food choices. Third one, food marketing. Food marketing is one of the dominant influencer for the food choices of school children. For an example, students told that when they see the food advertisement of soft drinks promoted by the cricketers and celebrities, they also wanted to try it. Now I am moving to the findings of the student survey. Student food choices are primarily driven by the taste, appearance, and the price of food. Actually, these results closely align with the qualitative insight that we gathered from the focus group discussions as well. And also, these factors led to the students to buy the unhealthy food from the school canteens. So, now I want to conclude the findings of the research. Key drivers of the adolescents' food choices include individual preferences, affordability, peer influence, availability of school canteens, nearby food outlets, and the influence of food marketing. So, based on these findings, we have developed a multi-component intervention as the next step. So, this integrated approach focuses on 3 key elements: establishing a school garden, providing nutrition education, and guiding towards a healthy school canteen. Together, these 3 components, we aim to create a healthy school food environment in Sri Lanka to promote healthy dietary habits among school children. So finally, I would like to thank my research team and the Nestle Foundation Switzerland for their funding. Thank you very much.
Thank you, Madhusha, for your very interesting presentation on adolescent girls or adolescents in Sri Lanka, and also for being an excellent example of sticking to time exactly. So thank you for that. If the next presenter, Rajni Wadhwa, the Director of Programs from Plan International, could please come forward. She's going to speak about empowering rural households through gardening approaches, capacity building, and community-led initiatives. Over to you.
So good afternoon, everyone. I am Dr. Rajni Wadhwa from Plan India, and today I'm going to share some insights from a very transformative initiative that we carried out in rural districts of India. So what we did was we set up to create nutritional security for 30,000 rural households through sustainable gardening and community initiatives. This entire piece of work was led by Plan India, but along with the women self-help groups. And we aimed not only to address the nutrition gap, but also to demonstrate economic benefits, environmental gains. Our objectives were about improving nutritional awareness, talking about diverse diets, good food habits, the health and well-being benefits out of that, establishing sustainable practices, promoting kitchen gardens, organic composting, and also to foster economic and environmental gains because we implemented a lot of impactful environmental practices as well, as I mentioned about tackling the household waste. We had a multi-pronged approach. We set up community groups. Around 500 such community groups were set up across 600 villages, which had more than 5,500 participants who actually underwent trainings, follow-ups. And these regular training sessions were actually very beneficial with this group. Along with that, we provided social nutrition safety nets by direct cash transfers. We conducted about a baseline with more than 5,000 women, which included different groups. We had pregnant women, we had lactating women, we had women who had young children. And as I earlier mentioned, that one of the highlights was this continuous engagement with these groups to bring in the behavioral change. So baseline suggested that only 7% of these families were consuming vegetables on daily basis. 64% were aware of the importance of nutrition, but 95% said that they were not really aware of the deficiencies, or they did not have money to actually meet the nutritional requirements. Our post-intervention findings and the improvements were really remarkable, with more and more people getting into consuming locally produced seasonal vegetables. We also found that now more than 90% households committed to continue with the kitchen garden practice. And another good thing was that the women's voice in household decision making improved from 38 to 58%. So that was one of the very important features of this intervention. As I earlier mentioned, that these households that were selected were very poor household, landless people. They had no land. The land just outside their house, sometimes it was around their house, sometimes it was the rooftops, sometimes it was the walls that were used to promote kitchen gardening practices. So that they have now started producing their own vegetables. That is a very economic benefit, and many of the households have now been able to also sell their market produce in the local markets. One of the story highlights is about a family in rural Bihar who is now earning money due to selling of the surplus vegetables and is able to continue their daughter's higher secondary education. So that is kind of a really impactful story that we came across. We talked about the environment benefits. There is now reduction in use of chemical fertilizers. Due to gardening practices, household waste management is being taken care of. And again, the remarkable change that we saw, 5,000 kitchen gardens were set up, more than 5,000 women across these 6 districts actually now have nutritional independency and also in many cases financial independencies. Transformative change across 140 acres of land which were barren, vacant, are now bright and lush green, and more than 12,000 tons of kitchen waste has been now converted to compost in monthly recurring way. So if I talk about the long-term sustainability, one of the highlights, or I would say that the self-help groups that were there in the communities who stay in those villages, who have now undergone trainings, are adopting healthy practices. They're also teaching this to their neighborhoods. And this continued engagement has led to a lot of sustainable attitude within those communities. So I think in conclusion, I would say that this particular initiative, if replicated, does have strategies that can combat malnutrition in many communities. And with this, I would like to end my presentation.
Thank you, Rajni. I mean, we are glad to know that like this kitchen garden has become sustainable, and also like it has some non-nutritional benefits as well, like women empowerment, generation of income for the families. So that is a huge impact. And you really, I mean, talked about this was a transformative initiative, and it really is. Thank you for presenting this initiative, and also let us know about the long and lasting impact of kitchen garden. So now I would like to invite Rajni Prakash, Tushanti Pereira, who is a senior lecturer from Wayamba University of Sri Lanka. And she's going to talk about food environments, the national level food environments in Sri Lanka, and the gaps, current gaps in research, and what are the implications of these gaps. Over to you, Tushanti.
Well, food environments usually hold a very specific place within the food system, where many efforts and interventions can be taken to address issues with respect to sustainable and healthy diets, while addressing many global issues such as malnutrition, climate change, and environmental sustainability. So keeping that in mind, I think the reason why food environments are like this, because they sort of contain the total options of decision making with respect to consumers or individuals, so that they can decide what food to acquire and consume. So with this, what I will be mainly walking you through is to sort of examine the food environments in Sri Lanka while elucidating the gaps in research, as well as to highlight implications for diet and health in the Sri Lankan population. So before I begin, I would like to sort of acknowledge the CGIAR Fresh Initiative, as well as local partner of research, Wayamba University of Sri Lanka, for sort of putting together this research, as well as for the D4N, for facilitating the dissemination of the findings that we have compiled. So obviously, food environments are inherently, they are complex and they are multifaceted. So if you look into the literature over the past few decades, most of the food environment related research is absorbed by developed countries or Western cultures. But now the focus is slowly shifting towards to sort of evaluate, understand food environments within low income and middle income countries. That is because that they are going through drastic changes and challenges. And Sri Lanka is not an exception to this. if you have been following the status of Sri Lanka over the last few years, you probably have witnessed that we have been going through tremendous economic, political, social transformations. And also with that entails the soaring food prices, skyrocketing inflation, rise in NCD burden, as well as the overall deterioration of the quality, safety, and the nutritional wholesomeness of the diets that we consume. So now I wanted to take your attention to whatever the little sort of statistics that we have in terms of the consumer nutrition perspective. So as you can see, many of the Sri Lankan population, based on these statistics, that they were not, consuming enough fruits and vegetables. And if I may take your attention to the food balance sheets that were produced over the years, in 2019, if you combine the total fruit and vegetable intake, it adds up to around 230 grams per day, which is far less than what is recommended by the food-based dietary guidelines for Sri Lankans, as well as the WHO standards as to how much fruits and vegetables that you should consume. And usually if you look into our diet, what the meals that we take, it is kind of interesting to see that we are our diets are usually very high in carbohydrates. Okay, I'm not sure if this is moving. Okay, this is not moving. Okay, so I was talking about the meals that we usually take. So we take copious amounts of rice with little vegetables or pulses or protein food items and seemingly disappearing fruits from our diets. So this is sort of acknowledge the point that I was trying to make in terms of what is happening with respect to our diets. Now, the thought process behind doing this study was to sort of really look into and understand food environments in terms of how we can promote or sort of foster fruits and vegetables into the diet. So we wanted to do a narrative review to really understand what is happening in the background and how we can foster fruits and vegetables into the food environments in Sri Lanka, and also to sort of do an ancillary assessment with respect to school food environments, because they are sort of like a micro food environment that exists within the total food environment. Since many youngsters, adolescents spend their most of the formative years in schools, we wanted to sort of look into whether the school food environments have the sort of the potential to address the issues with respect to fruits and vegetable intake. So what we did was we scouted articles that are published in journals and also reports and other documents that were published in the local setting as well as coming from international organizations. So we were able to sort of put together about 30 publications that looked into various aspects of with respect to food environments. Now I want to remind you that we were doing this review, we were basically focusing on fruits and vegetables, and we wanted to look into the school food environments, as I said, using the same lens that we use to assess the food environments as a sort of a micro level of food environment. So what we found out was actually, so Sri Lanka, the food environments in our country are varying in nature. So we have food environments representing the built as well as wild environments. And also they were mostly categorized or characterized based on the socio-economic, agroecological, as well as the geographical variation. So mostly sectoral-wise, urban, rural, estate, we would have seen differences. Now, so based on the review, we were sort of, which is obvious, of course, but with the review, we were able to sort of highlight that our diets are transforming and changing. So many Sri Lankan households, it seems, could not afford a rich food and vegetable rich diet. So with this, it is important to sort of revisit and reformulate our policies to make sure that we address issues with respect to food environments to make them accessible, affordable, and appealing to a wide range of consumers. Now, I told you we were looking into the school food environment as well. So what we identified, as our previous presenter has indicated, the school canteen, school meal programs, school gardens, and school policies are there, but they would still need repurposing and restructuring to make sure that they would address or help foster fruits and vegetables to the consumers. So obviously, this review has led us to believe that there are significant gaps. One thing is that food environments are quite new to us, and this research is quite new and young. So we need research and evidence-based research, as well as supporting multifaceted, multi-component interventions. So if you are really looking forward to, in terms of upgrading our food environments to foster more fruits and vegetables, it is important that support, intervention, research, whatever that we are planning to do, really should make use of the holistic end-to-end approach, and usually start from the consumer or intake side and track back to the food system, and to make sure that fruits and vegetables are accessible, and that we will have a year-round, safe, quality, nutrient-dense, a variety of fruits and vegetables are available within our food environments. Thank you very much.
Thank you so much for helping us deep dive and understand more about the food environments for your lovely, delicious food culture here in Sri Lanka. The next presenter is Anjali, a senior research associate for the Center for Chronic Disease Control, talking about food environments and their relationship with overweight and obesity.
Good afternoon, everyone. I'm Anjali. I'm from nutrition background, and I work with Center for Chronic Disease Control at New Delhi. So today I'm going to speak about the impact of adverse food environments. A lot of people have spoken about food environments till now, and its effect on the metabolic risk factors like obesity and HbA1c. These are the findings from the population-based study which was conducted in north and south of India. So the built-in environment data that I'm using for today's presentation was collected during the Uday study. And when I analyzed this, I was working on the chef study, so thanks to the funding agencies for both the studies. Giving a brief background, globally shown that food environments are closely connected with the multiple non-communicable diseases, and that is why it is gathering more importance. We look at the studies, most studies which have used the advanced technology like geomapping and relating it to the outcomes have been conducted in the developed countries, and there are less studies that are there from the LMICs or developing countries. During the Uday study, built-in environment data was collected, as well as the metabolic risk factors were measured in the community-based study. So I got opportunity to look at these factors and how they are associated with each other. Giving you the background of the study, this was a cross-sectional study which was conducted among 12,000 participants, around 5,000 households from north and south of India. There was 50% participants were male, 50% female. It has a good representation from both rural and urban areas. And we used the multi-stage cluster random sampling technique for selecting the participants. And as I already said, this data has been from the north in the Sonipat and south in the Vishakhapatnam. The households were from both these places. Looking at the measurements which are real, there were multiple measurements that were conducted during this study. I'm going to focus only on these two just now, that is the built-in food environment and the outcome variables related to the metabolic risk factors. So when I say built-in food environment, though it looks so simple here, there were more than 300,000 records that were available. So what we did is we took the geolocation of each household, and in that ward, for example, in the urban areas, it was ward as a unit. In the rural areas, it was Gram Panchayat as a unit. So from that each ward or Gram Panchayat, we collected geolocation of each of the shop that was providing food, whether it was healthy or unhealthy or staple, or all kind of food records were collected. We then calculated the distance from each household to each of the shops within that ward. and then the further data was classified. So when I say food density, it basically talks about the, when here I'm focusing only on outside food density, so out of home shops that sold either bakery products or fried products or sweets or salty processed foods. That data I'm going to present, but we equally collected the other shops that were providing data. It was difficult to classify sometimes because, you know, in a grocery shop, simultaneously there were fried snacks were available. So we really had to think about how to classify them. And then we took the decision that we need to record them twice, once under healthy and unhealthy. I couldn't see any associations in the healthy food environment. That is why I'm focusing on unhealthy food environment present here. But that was enormous data that was collected, which took almost 3 months to classify and come to some conclusion. It will vary from study to study. Again, in case of the metabolic risk factors, we have got n number of metabolic risk measurements. I'm presenting here only those which showed the positive association, which was overweight and obesity and HbA1c. But while checking, we checked the association with all the indicators. So basically, this study shows the association with food environment and body mass index and glycemia, controlling for all other factors like gender, urban or rural residence, wealth index, and fruit and vegetable intake and activity. These were the covariates that were controlled for. This table basically shows that we have got representation from all adult age groups. These were the adult participants from all the wealth index categories, starting from poorest to the richest, and from the both genders. This basically shows how the metabolic risk prevalence was there among the participants. And as we can see, the graph in gray indicates the overweight and obesity prevalence, that is more than 25 kg per meter square. We can see that urban, both in Sonipat as well as Vizag, which is Visakhapatnam, were higher in percentage than the rural. Same was there when it came to HbA1c levels. The participants with more than 6.5% HbA1c were higher in urban than rural. And we can see that when it comes to the food environment, we can see a similar picture. The first graph on the left shows the density. That means how many number of shops were there on an average from each household. So we can see that in Sonipat as well as Visakhapatnam, there were at least 18 out-of-home food selling shops around each participant. And when it comes to proximity, we again could see that within 500 kilometers, there were more shops selling out-of-home food in Sonipat as well as Vizag. We checked the association of these with metabolic risk, and we could find that density, those participants who had higher density of out-of-home shops had higher chances of being in the overweight or obese category or having higher HbA1c. Similar results could be found when we check those who are having shops within 500 meters versus, so if it was within 500 meters, there was higher likelihood of being in the overweight obesity category or HbA1c. These are independent models controlling for all the other covariates. So we can say that having higher density and proximity to unhealthy food outlets can increase the chances of having metabolic risk, and we need more considering the prevalence of diet-related NCZs. We need more research of these aspects to come up with policy solutions at the local level and actions. Thank you.
Okay, thank you, Anjali. Excellent presentation. We know that we are what we eat, and what we eat basically also depends on where we are. So thank you for presenting this. How proximity and density of unhealthy foods in the food outlets influence metabolic risk factors. Thank you very much. Now I would like to invite Afrin join up to present her study, and it is about healthfulness and retail food environment in rural South Asia. Over to you, Afrin.
Good afternoon, everyone. My name is Afreen. Today, I'm presenting our work on food environment in rural South Asia, which is a part of one CG initiative, TAFSA, that is transforming agri-food system in South Asia. Yeah. So, the food environment in low and middle income countries is undergoing rapid transformation, and that transformation needs to be recorded through empirical evidences so as to develop policy interventions that could promote healthy eating among rural folks. So with this background, we took up the study with the objective to assess the healthiness of the food environment in rural South Asia, and also to identify the regional or community socio-economic factors which drives or shapes the food environment the way it is. So this is a cross-sectional study which was conducted in 3 study locations, 2 in Bangladesh, that is Rajshahi and Rangpur districts, and 1 in India, that is in Nalanda, Bihar. So in each district, we randomly selected 50 villages based on probability proportionate to number of the households, and where we started a market census to document the density of retail outlets which were selling food items. And then it is followed by a market survey to see which is followed by an in-depth interview of those retailers to understand the availability, infrastructure, those regulation, marketing, etc. So parallelly, there was also a community survey to collect the information related to the village level characteristics such as the population, area, the facilities available, the other socio-economic parameters. So to study the food environment, we basically employed 3 indicators. One is just a density of the retail shop within each village, and then the relative density of retail shops, which is also called as modified retail food environment index, which is calculated by the given formula below. And one more indicator is a healthy food availability index. I would just like to give a brief elaboration for this. It's a score given to individual store based on the availability of a particular category of healthy food and also the varieties which are present in that particular category. And the scores were ranged between 0 to 28. So first we started with a basic descriptive statistics of the indicators, followed by the regressional analysis, where we have done a negative binomial regression and fractional probit regression based on our dependent variable. Our dependent variables, as I mentioned earlier, are the 3 food environment indicators, and our exposure variables are the community or neighborhood characteristics such as population, density, area, distance to the village, etc. And to study the association of this healthy food availability index, which is a store level characteristics, we again have used some store level characteristics such as its typology and the characteristics of the vendors. So coming to the results, we have observed that the rural food environment in South Asia is still dominated by the traditional kind of food outlets, which is the local grocery shops are the most important one among them, followed by the restaurants, specialized restaurants and tea shops, and specialized shops. This means that the shops which sell a particular commodity like a milk or meat or fish, etc. And the another important category we observed was a greengrocers, which sells fruits and vegetables. On an average, there were 20 retail food outlets in each village, which comes to about 8 outlets per 1,000 inhabitants in each village. And the second indicator, which is relative density, is on an average, it was observed to be 0.41, which suggests that there are more number of less healthy retailers compared to the healthy ones. So our third indicator, healthy food availability indicators, also shows poor performance, as all the study districts have very low scores with an average of 4. And the highest score for this healthy food availability was observed in case of greengrocers, which is just 6. So through a regression analysis, we have found out that the village level characteristics such as area, population, density, or the literacy rates, wage rates, etc., and also the village facilities present in the village have positive association with the density and relative density, whereas the distance to the nearest town has a negative association with the densities. So similar to that, we also, a similar association was observed for availability of healthy food. And the major driver for availability of healthy food at store level is the store typology and the size of the store. So overall, we can say that if the village has is a bigger one and have more number of facilities and more developed, the healthier will be its food environment. And in contrast, if that village is far away from the town, then it is having less number of stores and less healthier will be its environment. So overall, we can conclude it by saying that the retail food environment is still dominated by presence of unhealthy food. So to promote the consumption of healthy food in the rural settings, we need to concentrate more on designing the policies to modify the food environment. But we further need some more research to identify what are the interventions that could promote or that could healthify the food environment. Thank you. Thank you.
Thank you, IFPRI. I would like to invite all of the panelists to come back up, all of the presenters to join us on the stage. Thanks for that presentation, which was across countries and confirming some of the findings from an earlier study. And I really like your conclusion and hope that in the next D4N or the next 2, we'll start hearing less about the unhealthy food environments and more about the interventions, the policies and programs, and some uplifting news. So just because the conference is running slightly behind time, we're going to limit the Q&A to 10 minutes rather than 15. We hope that's okay. Are there any online questions that we should start with? Maybe we'll take one of those while those of you from the audience can start also thinking of your questions.
Yeah, we have one online question from L. Sherban. Thank you for these good presentations. A question for Dr. Ganpule Rao. If understood correctly, there was no association between the proximity or density of healthy foods with nutrition outcomes. Can you share any ideas of what that might take to be able to find that?
Okay, let's collect 3 questions before turning over to the presenters. In the front here, please introduce yourself. And
thank you, lovely presentations and a lot of insights. I wanted to know has anybody explored the effect of online websites for ordering food or home delivery or telephone, because that crosses all proximity backgrounds, you know, and that's a big influence we see nowadays.
Thank you. Could you introduce yourself while you have the mic?
Yeah, I'm Professor Seema Puri from Delhi University.
Thank you so much. One more question, perhaps from this side or in the back? Anyone? Okay, over to the panelists.
Thank you for the question. I was looking forward to these associations if the healthy food environment, when I say healthy food environment, we looked at the density of number of shops selling all the staple foods, grains, nuts, and all the pulses, milk, vegetables, and fruits. So all of them were counted together as healthy food density, and I tried to check whether it is associated with any of the BMI related categories or this thing, but there were no associations that I could find, maybe because it was easier to bring out the worse food environment and its association with metabolic risk factors, but I'm not sure if we can measure more healthier traits. Maybe it will be interesting to look at the behavioral factors and associate it with the healthier food environment. Here we had the metabolic risk, which is mostly associated with the unhealthy or out-of-home food environment, so I could bring it out in this research. But during all this process, I understood that we need some kind of a qualitative research to support all these findings, how the different aspects related to preference and choices and all these. We could bring it out in the chef study. We have already published a paper related to snack food behavior and its association with metabolic risk. But there we lack to measure the food environment as such. So maybe in the next study I could include that. Yeah.
I'll take that question, though we used this methodology to our advantage. It may not be the exact answer to your question, but what we explored, we did another nutrition intervention with pregnant women in rural Rajasthan, where we provided them with cooked hot meals at their doorsteps to combat malnutrition in the mothers. We realized that the caste system is so prevalent, so these are all the social problems. The caste system is so prevalent that a malnourished women from a higher caste household would not accept food from a lower caste person if that is being cooked there. So we brought in a rural Zomato, if you may like to call that, to take advantage of that. We had delivery agents who would pick up the food once it is, so this was we tried a tech-based solution here. It was an online platform. As soon as the request for the meal went through the auxiliary nurse midwife to the person who was preparing, again, women self-help groups who were preparing this food, the delivery agent would pick it up, make sure goes to the household and gives the hot cooked meal at the doorstep. So we tried this model to our advantage, but I know this is not an answer to the question that you're looking for. In our intervention, we have not yet tried that, but it will be, we are working on another model for Child for Nutrition, and I think we'll include this there.
Seema, I would like to answer your question. So we did not address this in this study, but there was another study called as UFSIN, Urban Food System, and what we were system measurement development. So what we were trying to do is to develop a tool for FAO, which can measure the urban food systems in Asia, and we could pilot it in India and Nepal. And it has been published as a UFSIN technical guideline, as well as reports from Pune, Ahmedabad, and 2 cities in Nepal. And in there, we could capture the online, how the different things were available and how they were accessible. It was developed in just 2 cities, but we can check it. And we also looked at the other factors, whether healthy food is advertised or not, even in the shops, and how it is advertised and whether it is available on the online platforms. So that shows, though it was on the smaller, because we were just modeling, developing the tool and adapting and modeling, it was on smaller number, but we could find that the number of people who are ordering online is increasing, and that proximity matters a lot.
I think also in the built environment, even in urban setting and in rural setting, we have a lot of sort of a cart grocery people who bring fruits and vegetables. I don't know how, because that is the green grocer aspect that you are taking into consideration. So I know in Pakistan, even in major urban, you would have these people who would bring on a cart fruits and vegetables. So how do we make sure that we incorporate that when we trying to study the built environment in both rural and urban? Because we just go to the stores and we say these are the stores. Mostly the stores are selling more non-perishable items, but we should take into consideration this.
Thank you for that comment. I think we only have time for maybe 1 or 2 more questions. So there's a hand in the very back. Could we get a mic there?
Thank you. I am Ms. Dinti Samarakam from Edith Cowan University, Sri Lanka, and I am a current lecturer. And also I was previously working in 9-country study with Professor Taranga Thoradini, Faculty of Medicine. So we were studying related to television food advertising, including these countries, and we had a nice finding, and it is on the way. So I would like to ask from the panel, is there any studies done related to, and whether you have used nutrition profile models related to measure whether foods are unhealthy when they are marketing or not, or just to get a comment on WHO nutrition profile models? Are you using that for healthy, and or how you actually categorize the product according to whether they are healthy or unhealthy for the to market? Is there any comment on that?
So we've had 2 comments from the floor. Any reactions from the panel?
So to just elaborate based on the review that we did, what we found out was that in Sri Lankan context, we don't have many food environment research. And whatever the research that were done were basically focused on identifying consumer purchasing patterns. So that did not exactly reflect what vendors would want and what consumers would want to take away from the food environment setting. So I think this is a burgeoning field right now. So a lot of potential to do studies with respect to food environment, especially with the FRESH initiative going on, looking into the end-to-end approach. But also to tackle the question that you asked, while we were reviewing the articles, there were nothing related to those consumer profilings or the nutrient profilings with respect to consumers or vendors. So, you know, connecting the dots with, you know, the food environment. So they were basically looking into sort of, you know, defining food environments, characteristics, and, you know, what is just sold in the market. And very few studies even looked into the fruits and vegetables, let alone the healthy, you know, sustainable diets and how to promote that through the, you know, the food environments.
So your previous question on cart vendors who sell fruits and vegetables, in our study of TAPSA, what we did was we identified a most populous spot in that village, and we stood, the enumerator used to stay there for the whole day and try to see, try to identify any mobile vendors, and there any information, the survey, everything was done at that spot.
So maybe a round of applause for all the presenters. And I think you can now take your seats, and we'd like to ask for the rapid fire presenters to get ready. We only have 4 because the last presenter has, 3, as the last presenter has dropped out.
Okay, so we already listened to like 5 fabulous presentations, and stories, like it is about school environment and outlets, shops, and how availability of food influences like our health outcome, nutritional outcome. So now it is time to move to the rapid fire presenters. So at first I would like to invite Nadia Shah, who is a senior lecturer from the School of Public Health of Dow University of Health Sciences. And she's going to share her findings from an integrated household food system approach that improved nutritional outcomes in rural communities.
Greetings and good afternoon. I am Nadia. I'm going to present results of my study quickly. Okay, just to give you, this study was conducted in Balochistan province. Balochistan is the most backward and the problems with most health issues, right? It has the highest prevalence of malnutrition and stunting. Okay, integrated household food system programs, perhaps, focusing on food security and nutrition provides, greatest opportunities for women empowerment in rural communities. Okay, I'm presenting the results of a survey that was case control study, cross-sectional survey that was conducted after the trainings were provided to the women in case and in control and intervention groups. The findings reflects positive impact, positive change in knowledge, attitude, and practices of women who received trainings towards integrated households food systems, right? Their knowledge was comparatively quite higher related to nutrition and health, as well as they showed positive attitudes and behaviors towards accepting the trainings, actually the training that were provided that actually helped them in showing improvement towards nutrition and health outcome. So the lesson learned reflects that the training had significant impact on ACAP indicators, that is awareness, knowledge, attitude, and behaviors toward health and nutrition. Training and other FFS incentives can add value to participant engagement, improve attitudes, and capacity building especially. So if SPCC, social and behavior communications channels interventions can achieve behavioral impact in conservative remote communities in relatively short time period. Right, the baseline survey findings have already been published. Right, this is the post-survey result, and I'm working now on the baseline and the post-survey differences. Thank you.
Thank you so much, Nadia. The next presenter is by Donna, a research economist at the Institute of Policy Studies of Sri Lanka.
Good afternoon. Understand healthier food environment in Sri Lanka. And propose is a qualitative synthesis of trade, political economy analysis done on sugar, tobacco, and alcohol industries. And the main data sources were the key informants from various stakeholder categories of these industries. And we took for the data collection and data analysis, we took the deductive framework approach, focusing on power dynamics and interactions between stakeholders at policy implementation, policy formulation stage and policy implementation stages. And at the findings, at the policy formulation stage, lobbying emerged as the main strategy of influence. And at the policy implementation stage, in the case of SSB industry, aggressive marketing campaigns, pricing tactics, and delayed enforcement were the main strategies by the industry. And also they responded by reformulating their products and introducing new products. In the case of alcohol and tobacco industries, indirect marketing and promotion could be seen, as the direct marketing and promotion is prohibited by law for these industries. And the policy implications are clear. there is an urgent need of exposing unethical practices by these industries in influencing public health policies to ensure greater transparency, accountability, and also there is the regulatory framework should be strengthened in order to ensure that industry actions are aligned with the public health goals. Thank you.
Thank you. Like, industry has a huge influence on what we eat and on our food environment. So the third presenter is Samuel Scott from IFPRI, and he's going to talk about new methodologies, probably like mixed method to improve how we measure large-scale food fortification coverage.
Okay, thank you. I'd like to begin by acknowledging my co-authors who were shown on the previous slide and the funder of this, the Gates Foundation, who funded a project called DataDent. And DataDent is interested in understanding how we can improve measurement of programs. So one of the programs we're interested in is large-scale food fortification, which involves the addition of micronutrients to commonly consumed foods. But when they do that, nothing really changes. It tastes the same, it looks the same, so it's sort of an invisible intervention. You can't go to a household and ask someone, do you consume fortified foods? They don't know what fortification is, and they don't know what a fortified food is. They just consume their regular food. So the purpose of this work was to try to say, could we go to households and do anything like ask questions to try to understand coverage at the household level? Usually they do testing of fortified foods at factories, but there's nothing done at the household level, which is not good because we'd like to see who's actually consuming these foods, who is being reached. So what we did here was some formative research in Ethiopia and Bangladesh. We tried to improve GAIN's fortification assessment coverage toolkit. This is a set of questions for households that asks things about the packaging and the brand and so on. And what we found in markets was hundreds of different brands, so you cannot really use recall aids like pictures to get that information. Recall is challenging because it's often repackaged in containers that don't have any labeling, for example. So probably don't have time, but the end goal of this is to come up with a standard set of questions and indicators that can be used in large-scale household surveys like DHS, or national nutrition surveys, and so on. Thank you.
Okay, thanks, Sam. Rapid-fire presenters and presenters of the oral presentations. We learned a lot about food environment, both built food environment and natural food environment, and we also talked about problems, and some of the solutions have also been talked about, and how programs can make changes in the lives of people and also the environment where we live in. But in future, like, we would like to see more interventions, how we can make changes, like what the first presenter, Madhusha, talked about, like designing new interventions and testing them to improve adolescents' food behavior and choices. So that is for the next D4N. We want to end here. And thank you very much for your patient hearing, and also, like, let us give a big round of applause for all the presenters once again.
All right, thank you very much, everyone. Thank you very much to our session chairs. That was a formidable task to keep us on time, but I think you did a really great job, so thank you very much for that. Thank you to all of our presenters. Our next sessions will be 3 parallel learning labs, one by BRAC University, one by Fresh Sri Lanka and Wayamba University of Sri Lanka, and another by UNWFP. Due to limited time, I'll just encourage you to review your agenda booklet, but for now, we have tea outside, and the next session will be starting in about 30 minutes. Thank you very much.